You're listening to Sports Medicine Weekly on ESPN 1000.
Welcome back, everyone. Sports Medicine Weekly on this Saturday morning. Steve Cashel with Dr. Brian Cole. We come your way every Saturday between 7 a.m. and 8 a.m. here on ESPN Radio 1000. And Dr. Cole, next topic of discussion, let's talk a little bit about joint pain. Not structural, would you say? I mean, let's talk a little bit about knee pain and reasons to go to the doctor. And we've got a device we're going to introduce you to that might make trainers more valuable. That can be a unique device, some modern technology that can non-invasively detect muscle imbalance. What do you think about when you think about muscle imbalance?
Steve, it's interesting. As a surgeon, one would think that most of my time is spent doing surgery, but that's actually not the case. I'd say that possibly 2 in 10 patients who come in actually have a structural abnormality that requires repair. So, people's biggest fears are I have a tear in the ligament, cartilage, a strain, a sprain, something that just is broken and needs to be fixed. But the interesting thing is that the majority of ailments, at least that I see, shoulder, elbow, knee, and this would extend to the back, the ankle, and so forth, are dynamic in nature, and that means that there's some type of muscle imbalance that, if corrected, the pain goes away. The knee is a great example. We often say sort of the knee is a poor stepchild caught between the hip and the foot and the ankle, and knee pain is incredibly common, but it's rarely due to something structural or abnormal, and that's why many of these patients end up getting therapy or you are recommended to use exercise as a form of treatment, which frankly it can be more effective than surgery. In fact, most of these things are not able to be corrected with surgery. So we have a great guest, Chuck Schwerin is with us, and the technology that I've looked at is it's a company called MyoWave, and I wanted to bring him in to sort of talk about this because it provides a source of biofeedback for patients that they otherwise wouldn't have. The hardest thing is to, after you identify an abnormality and say muscle strength or imbalance, is to say, okay, go correct it. It's not only hard for the patient, it's hard for the therapist because they can't identify if the patients are actually contracting or fire the proper muscle groups. So first identify an imbalance and then figure out a way to correct it and then give the patient some feedback in terms of, hey, I am actually contracting the right muscle groups, and I'm going to get better because I have visual feedback as to what's going on. So, Chuck, thank you very much for joining us. We're really happy to have you here.
Good morning. Thanks very much for having me.
Would you be able to tell us a little bit about this technology? Hopefully I summarized it from my point of view as a physician, but you are sort of the guru with the science here, and we'd love to hear a little bit about
Remarkably
what this is.
Well, actually. Synostics is a spin-off from the Binghamton University bioengineering work, and the core technology that we're commercializing now is essentially the ability to non-invasively convert muscle vibration to absolute effort for the purpose of detecting imbalance, as you mentioned before. So this is an incredibly easy-to-use modality that simply involves putting a sensor on the belly of the muscle that simply listens to the fibers as they vibrate. There's nothing going into the body. There's no electricity involved. It's completely benign, and the result, frankly, makes the practitioner that much more valuable because they've got objective information on which to make decisions about how best to target an exercise regimen to help either in prehab or rehab.
So I'm looking at the device now. It's basically a band, and I assume there are sensors in the band or sensors that go underneath it?
The band is simply elastic with a buckle for tightening. The sensor itself is about the size of a $50. It's accelerometer based. We're using the most sensitive and noise-free accelerometers in the world, frankly, and they pick up the noise that comes from the muscle fibers as they vibrate. And the more effort or the more work that the muscle has to do, the more fibers are recruited, and the more information comes through the skin surface. The secret sauce here is our ability to filter out the extraneous information and display on the screen real time exactly the amount of effort that muscle is exerting.
So a very common complaint that we get is anterior knee pain in the front of the knee, and this is an easy thing to assess in the office. rarely needs an X-ray. It's a history, and it's typically both knees, more female than males. It hurts going up and down stairs. Getting out of a chair to standing position, there's a sign called a movie theater sign where people say, it just hurts when I sit with my knee bent for a prolonged period of time. And people are inexorably worried that there's an arthritic process or something that needs to be fixed. Otherwise, they end up with a knee replacement. That's not the case. They usually go to physical therapy. So I'm curious, if I had a patient who I was going to recommend physical therapy, and it's often due to muscle imbalance, and it may be something as simple as quadriceps to hamstrings in terms of how they contract. How would this device be used in that setting?
So we would have you ask the patient to, first of all, we'd put a sensor on the inside and the outside of the thigh, the vastus lateralis and vastus medialis, perhaps one on the hamstring.
How many can you measure at once?
We can do 6 at once simultaneously.
Wow.
And then the protocol would be as simple as stepping up onto a 10-inch box and down to the floor again. It's a very benign protocol. But the information that's delivered is exquisite in terms of your ability to see immediately the degree to which you may be out of balance.
Again, we're visiting with Chuck Schwerin. He is the CEO of Synostics. They make the MyoWave product, a new unique device that non-invasively detects muscle imbalance. Chuck, a question for you. How long is the application and assessment?
Well, to do the protocol we just talked about is probably 5 minutes. Then there's obviously more time in terms of describing to the subject exactly what the implications are. But in terms of actually performing the protocol, it's slipping an elastic around your leg, slipping the sensor underneath the elastic so that it's on the belly of the muscle, stepping up, stepping back, or doing, let's say, a single-legged squat to isolate one leg. Do 10 reps and you're done.
Wow. So my sense. So I think our listeners need to know this is not something they're going to go out and purchase, and there's really no need for someone necessarily to go out and purchase it at that level. This is something that a therapist or a trainer would use in a session that was prescribed by a physician. I'm just trying to paint the scenario here how I would use it. Physical therapist would do an evaluation. It would allow them one other objective assessment of muscle function. Right, it's painless, it's quick. They would be trained by you to, or educators. How long is there? What is the training involved?
A couple of days.
Okay, so they take a course, they get certified in this.
Correct.
Okay, and then they would learn to evaluate a patient based on a certain prescription, and then they would prescribe a regimen to correct the imbalances. Right?
Correct.
And then they would retest them to see that if they've corrected it.
Absolutely. So you can determine, again, if you're looking at the involved versus the uninvolved leg. If we're talking about the knee, you can determine how far off you are, and then track your progress and determine when you've met your goal. So it's making the practitioner that much more valuable because it's giving them objective information on which to base their determination of what should be done about the problem.
Again, our guest is Chuck Schwerin, CEO of Synostics, introducing the new MyoWave product. And Chuck, what other applications might the MyoWave be useful?
We had never thought of one application that some folks from Scandinavia are now using it for, and that is high-end bike fitting for cyclists and triathletes. And the purpose of using MyoWave in that fashion is to optimize the way an individual is sitting on their bicycle and the technique that they're using to actually go through the pedal process. And by using MyoWave, you can actually do a sort of a super slow-mo on each cycle of the pedal to see what the contribution is of each muscle that's involved in the effort to move the pedal around. And in one example where a world champion, I guess he's not a world champion yet, he's about to go to Hawaii for the Ironman championships in January from Denmark. He was having some pain that was identified in part through the screening that was done with MyoWave.
Wow! So he's on a bike then, right? And you can put the sensors
trainer,
on,
right?
Yeah.
And he's
and you
cycling
can measure
at
and assess
full speed.
these things. Yes.
He's going full speed, and what we're able to do is look, on average, what contribution each leg is making, but then drill down so that you can see what each muscle is contributing. So you're looking both at the sort of the timing of each part of the cycle of each pedal, as well as the amplitude coming from those muscles commensurately. So it's pretty powerful.
Yeah, and Dr. Cole, that would be known as dynamically testing someone. I mean, not only them in an office, but whether on a bike or an apparatus of some sort.
Yeah, I mean, we have things that are, pardon me, we have things that are similar but not as thorough. In other words, we do some objective testing to check isokinetic strength, which is almost an archaic assessment now. We don't use it very often, but I can tell you I'm thinking about these things all the time now.
Is that with the dynamometer?
Yeah. Well, it's not it's a dynamometer. I gotta say it again. Dynamometer.
Which measures torque as opposed to muscle effort.
Is a similar concept, but these are expensive tools that a lot of therapy centers have kind of gotten rid of. We have one, but I use these things when we're trying to assess, for example, return to play after ACL injuries, which is a topic that everyone likes to hear about. And so, for example, we're assembling a whole cadre of objective tests that we can use: single leg jump, isokinetic testing, box jump, ladder drills, landing off a box, things of that nature, and even video assessment. To me, this is one tool that could be used in that regard as well. I would ask that we probably think hard about validating some of these things, which is tough. But intuitively, it makes sense to have a screen to be able to do a visual screen to be able to assess something objectively for deficits, and then train and retrain, and then come back and assess again. Mm-hmm. And if that translates into lower injury rates, into reduction in pain, into safe return to sport, things like this are invaluable, and I can tell you, and I know the reimbursement pathways can be challenging here through the physical therapy centers, but there are pathways to do it, especially if under prescription, and there's a lot of value added for something like this. So we're going to stay tuned and hope that we get it here in Chicago, and something that we'd be interested in actually using on some of our own patients.
We look forward to that.
Chuck, website, any information, if trainers out there, other doctors listening, more information from you?
Sure, a couple of things. Number one, if you want more information, you can drop us an email at info@sonostics.com. That's SONOSTICS. Visit our website, sonostics.com, or you can go to YouTube and search on Sonostics, and there's a whole host of videos so that you can see the technology in action.
Wonderful. Chuck, thanks so much for joining us here on Sports Medicine Weekly.
Thanks so much for having me.
That's Chuck Schwerin, CEO, Sonostics, makers of the new MyoWave device. I'm Steve Cashel with Dr. Brian Cole, back with more of our program, Sports Medicine Weekly, right after these messages.
On ESPN 1000.